Right, can you say hello?
Hello.
Good morning.
Good morning.
Welcome to our day. Hello.
Hi.
So, following on from my dear doctor conversation the other day, they've arrived. I don't think there's a difference.
No, it
but
doesn't look like it.
These are the home COVID tests. Like we said the other day, we were not happy with going to a test centre because I know all the precautions are there, but there's still going to be positive people mingling around, and you have to take your mask off to do it, and like you're going to then drive up and park into the exact same space, and I know that there's wind around, but if something then gets caught on the person and then as they move it breaks away and happens to by chance fly in the car, it's not worth the risk.
And as well, depending on how it's done, because some places are doing it where the nurse or whoever it is that's doing it, they do the swab on you. They wouldn't be able to do that to Charlie very successfully because Charlie's in the back of a van
so I would have to get out
in. And it's just, it would mean that there was more time for her outside and just more chance of bugs and everything. It's just something that we didn't feel comfortable doing.
No. So thankfully they do have them online. For the UK, if you go onto the Gov website, or even if you just go to Google and type in home COVID test, it will take you through to the appropriate part of the Gov website. You've got to fill in your details, when you think the symptoms might have started. In Soph's, there's an out. Did you just sneeze fart?
I might have just sneeze farted. Oh, hi, Mom.
What are you doing?
I don't know. Trying to waft my fart.
Yeah.
Yeah. I broke myself. Am I looking at
Yeah. Wow.
it? Try to set this up again now. Face. Oh, it's not too bad.
Are you quite alright?
Oh,
Yeah.
yeah. Yeah. Funny. Alva shark doo 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 doo. I'm sorry, princess. I offended her. She said mama. I'm sorry.
What did she do?
I'm sorry.
Yeah. Oh. Yeah. With regards to Soph, because obviously she doesn't have symptoms, when it came, because when, you fill in the bit for the person who's been in contact and present, showing symptoms, and once you've done that, apologies, it goes to another bit and asks if there's anybody else within your home who also need to test. So then you can click on there, and then you got to put all the details in again, and they ask whether they're presenting with symptoms or not. So obviously Sophie isn't, but because she lives in the same house, she's obviously at risk as well. And they send them out to you, and you receive them within 48 hours, I think it is. But I don't remember how quickly they need to be sent back. I'm hoping it's going to say. You also get given a text message, and in there is 2 codes that when we're putting it into the envelope to send back, we have to put those codes on there, and then it links to all our details so that we don't have to put it all.
Both codes?
Yeah.
Cool.
Yeah. 2 sets I need to sort it. That whole thing, I threw the ball. she caught it, it hit off of her face, it went right up, and then it bounced behind her, and then she came rolling this way to come get it. That's what all the noise was. And then she had to quickly turn around and go back because it bounced behind her. Quite funny.
Quite spectacular.
So it came in this purple packet. Both of them are in these individual ones.
We just rip it open.
Yeah, I reckon so. I mean, we know it's going to come back negative, but
it still makes you feel anxious.
It does.
I feel anxious.
And my doctor has requested that I need to do it because my symptoms, they are identical to what COVID are. So they're telling me I have to do it for my own safety. But like we said in the vlog the other day, if you wanted to go back and watch that one, if I had COVID, I would not be sat on this bed talking to you guys. I would be in hospital, probably in the intensive care unit, because of my lung disease. But it's a formality that the doctor wants us to do. So it's kind of in this cardboard thing. This is the box you've got to make to send it back, which is pretty cool. There's a bag to put the swab in afterwards. Not quite sure what this bag's for yet. We need to put a security seal on the box so that it stays safe. Not quite sure what that's for.
We'll find out. It says it all in here.
And there's a little vial with the little water thing in it that you get it. So you get this book, COVID-19 Home Test Step-by-Step Guide. And then you got the name. Before you start, read the instructions before you open the test kit. Wash your hands for 20 seconds before you handle the test kit. If more than one person in your home has taken the coronavirus COVID-19 test, please make sure you have a test kit for each person. You'll need to register each person's test kit. And then it's got a checklist of things that you need to make sure you do. The test is suitable for the following people. Adults age 18 plus, the self-test, unless able to do so. Teenagers aged 12 to 17 is self-test with adult supervision. And children under 11, well, 11 and under, adult to test, please use the how to test on a child supplement instructions and tips on page 19 to help you test your child. And it's got coronavirus guidance and help websites and phone numbers. Then it's got the how to test someone else tips. So it says, prepare to take the sample, talk through the steps together. If possible, do a mock practice without using any of the testing materials. So I guess you could use like a cotton, cotton swab bud thing. Yeah, cotton bud thing. Take the sample, talk them through what you're going to do for both the tonsils and the nose sample. Tonsils. Oh my god. Play games and suggest they stick their tongue out. Get them to copy you. Then get them to say "ah" loudly for 5 seconds so that you can have a view of their tonsils at the back of their throat. Get them to say "ah" loudly 3 times. Then introduce the swab stick and ask them to keep saying "ah" while you take the swab sample. If you can hear squeaking as I'm talking, I think it's because I've got like gunk around my vocal cords and it's continual and it's actually putting me off. Please go to page 19 for step-by-step instructions and tips on how to test on a child. Then you've got to find your nearest priority post box.
We've got one on the estate, so
yeah.
Okay.
It has got the website and everything on this page for you to see. It's got here, unable to get to a priority post box. If you're unable to get to a priority post box without using public transport or unable to follow the government social distancing guidelines, are shielding, classed as vulnerable, or too unwell to leave your home, call us for guidance on when to take your test and how to book a courier collection. That's really cool.
Yeah.
Register your test kit details, and you can register it online, and that's what the barcode is for. Need your order ID, which is the ones I got. You should have received an email, so put your email in. Might be in your junk. Your test kit barcode on the cover page of the booklet is made up of letters and numbers. Check the barcode is the same on your booklet, vial, biohazard bag, and return box. The barcode number on the prepaid Royal Mail return label. Enter the numbers and letters only. Do not include the hashtag. Refer to page 10 for your test kit content checklist. Take swab sample. When to take your swab sample? You can take your swab sample after you have checked the collection times of your nearest priority box and register your test kit online. Take the swab sample on the same day you will post. So it's going to be going to the post box in a minute. For taking your test. Taking the test will feel a little uncomfortable and unusual for most people. Remain calm and confident as you go through the process. If possible, do a mock practice without using any of the test materials. See how to take your swab test by watching an online video. This is for home test kits in the UK. Exact models may vary. That's really cool. They've also got a YouTube thing of it. And it says, number 1, wash your hands thoroughly for 20 seconds using soap and warm water. This is so that you do not contaminate the test. Clean and dry a surface to make the to place the home test kit on. Unpack everything from the kit onto the clean surface. 3. Use the test kit checklist to make sure you have everything. And then it's got something broken, damaged, missing, difficult to use in the kit. If you notice anything damaged, broken, missing, or difficult to use in the kit, do not use it. Call your local number and request a new kit. And it's got the numbers. So, test kit, Ziploc bag, which I'm presuming is that one. Swab inside a sealed wrapper. Plastic vial containing a small amount of fluid, liquid. The liquid must stay in the vial. White absorbent pad. Biohazard bag with silver seal, which you can kind of see it there. Security seal for the return box, and then the return box itself. Number 4, look inside the mouth and find your/their tonsils at the back of the throat. You'll find yours easy. Soph's got like golf balls for tonsils, like all the crevices and everything. Mine,
you don't even have tonsils. They just basically get me.
Yeah, it
whereas
like sucks in.
Whereas mine are literally like, this is the top of my mouth and it goes. Whoop.
They're practically touching her tonsils are. But mine, yeah, they've vanished.
If you've had your tonsils removed, it says in here that you just do it where they used to be.
Yeah. It says that you can use a mirror to help and a torch also. Gently blow your/their nose and cough into a tissue. This is so that excess mucus does not interfere with the test. Throw the tissue away in a closed bin. Wash your hands thoroughly for 20 seconds using soap and warm water. This is so that you do not contaminate the test kit. Open the package and gently take out the swab. This will be used for both tonsils and nose. Well, I'm glad we don't do our nose and then the tonsils. Important, do not touch your tongue, teeth, cheeks, gums, or any other surfaces with the fabric tip of the swab. If it touches anything else, it may invalidate your sample. Taking the sample may cause gagging and minor discomfort, but it should not hurt. Holding the swab in your hand, open the mouth wide and gently rub the swab over both tonsils at the back of the throat for 10 seconds. Use a torch and/or mirror to help you do this. Remove the swab from the back of the throat. Put the same end of the same swab gently into the nostrils about 2.5 centimetres. That's probably that. That's the length of my nose.
It'll probably be longer than my nose.
I'm going to have to do it on my left nostril because my right one's blocked. Huh.
It's okay because you have to use the one that doesn't have a piercing.
Oh, yeah. Rotate the swab for 10 to 15 seconds and slowly remove. Important, this may feel, may feel uncomfortable. Do not insert the swab any deeper if you or they feel strong resistance or pain. Put the swab into the vial. Make sure the fabric tip is facing down as you place it into the vial. Snap off the stick end so that if it fits inside the vial without bending, securely screw the lid into the vial. Important, you must keep the liquid in the vial. Securely screw the lid so that no liquid can leak. You may need to apply pressure to get the lid on. Wash your hands thoroughly for 20 seconds using soap and warm water. First, place the absorbent pad into the Ziploc bag. I'm guessing that's the case, so if it busts open, yeah. Then place the vial next to the absorbent pad in the same bag. Seal the bag. Place the Ziploc bag into the biohazard bag. Make sure the barcodes on the plastic vial and the biohazard bag match. Seal the bag using a silver seal. I wonder why it has to be silver.
I don't know.
Assemble the return box, following the instructions on the box. If you can, wipe down the bag and box with an antiseptic wipe. Do they provide that said wipe?
Nope.
No. Put the biohazard bag into the box and close the box. Apply the security seal as directed. I wonder if when the postman goes and collects these, like, the mail from the letter boxes,
Yeah.
and he sees these boxes, I wonder if they're like, shit, somebody on this, like, estate has got COVID. I'd be shitting myself. Yeah.
I'd be terrified thinking there could be COVID in this box.
Yeah. That's quite horrible.
Yeah.
Take a picture or note of the barcode on your Royal Mail return label so you can track the delivery. You're now ready to post your test kit. Post completed test kit in your nearest priority box. Get test results by text and email. I've set it up so we can get it on both. How to test on a child. Important. Do not conduct this test if you do not feel confident. Do not continue the test if the child has any pain or asks to stop. If for any reason you can't do the test, please continue to self-isolate as a household. The fabric tip of the swab must not touch anything apart from the tonsils at the back of the throat or nose. If it touches anything else, it may spoil your sample. Prepare to take the sample. Remain calm and confident as you go through the process. This will help the child to stay calm too. Talk through the steps together. If possible, practice without using any of the testing materials. If the child is old enough, explain the test in terms they can understand. Might help ease any fear. For example, you may want to push the swab away, but it is really important you let me tickle your throat and nose so that we can tell if you might have coronavirus. If younger children, it may be helpful to give them a distraction whilst you conduct the test, such as a video, or make it into a game. You could also plan a reward for the child after the sample is taken. If possible, have the child sit on someone's lap or have someone hold their hand to try and make them feel more comfortable and secure. Decide before starting who will comfort the child and who will do the test. Play games and suggest they stick their tongue out. Get them to copy you and then get them to say ah. Show them the swab and have them keep saying ah while you swab their tonsils. Your child may have some gagging or brief discomfort when the swab touches their tonsils. This is normal for all age groups. Enter the following into the browser to watch a video on how to test your child. and then it's got the
basically how to take sample from a child, basically.
Yeah, from a extra, like the next age bracket, and their pictures are terrifying.
Yeah, they're not ideal.
And then it's got a bit of get help if you're worried, and also coronavirus in children. And then it's also got a need help thing. So we'll probably do it one by one and record each other, so you can see how we do it. So let's change the camera around. Hands have been gelled, nose blowed, and coughed.
I don't like this at all.
Yeah, see, I've had loads of swabs because of being in hospital and obviously working in a hospital.
Okay, on one of my tonsils I gag, so we'll see if I can manage this without gagging. Need to breathe. I lost count. How long was that?
I don't know.
I'll just do it again. Okay. Put the same end of the same swab into your nostril. Okay then. Just like this. Exactly, that's been like 10 to 15 seconds yet?
Yeah.
Okay. I'm sure it doesn't tell you to do this, but I had to get this. Okay, so... Don't look at my sample in case it's gross. You're looking! Stop looking! Stop looking
It's
at
fine.
my sample. That's vile.
You put it in the little vial, literally, vial. Snap where the little...
The liners.
Yeah.
How do you do that?
Bring it towards you.
Oh, it's okay, I did it. That's not actually as hard as I thought it was going to be.
And then put the lid on. Boom.
The only problem is though,
Yeah.
I've done that, which is fine, but on here it says that it's too short if it doesn't reach the top. But I did it where the snappy thing was. And there's only one snappy thing. So I'm presuming that's fine.
Yeah.
And put it in.
If you just leave it like that, it makes me need to check the barcodes.
Okay.
Don't be zooming in or anything like that, just...
I wasn't going to.
I know how much you like to zoom.
Oh, not when you're sticking things up your nostrils and in your mouth. Is the writing on your hand okay to be seen?
Yeah.
Cool. You need like 17 hands, don't you?
This one may not got a thingy attached to a wall or anything.
For someone who doesn't have tonsils, you certainly gagged a lot then.
It's also this, there's a very pungent smell coming
There
from
is,
it.
isn't it? I think that's what's made my nose sting. Plus it's quite a big swab. Yeah, I was a bit like that as well.
Oh.
Nostril hole. Left one.
Oh, it tastes awful as well. That's...
No.
I've lost count.
Go for like another couple seconds. Yeah, it's probably fine.
Boom!
Yay!
That tastes disgusting.
Yeah, not ideal, is it?
No. So it's now all in its little box. The box was actually quite easy to put together.
I was just about to say the hardest part of this was putting together.
Oh, so it was flat. You just lifted up these bits and then folded the little tabs under so it hooked into them.
That's what you had to do.
Poor Soph.
Cool, right?
Obviously all of our barcodes and that matched up, so that was good. God, this is difficult to do one-handed. Let's tuck that little bugger in. Oh my goodness. Nope. Boom. So that's all done. God, that'll be why they need the security sill. The box doesn't even shut properly.
Yeah.
This one's having a bit of a moment. Whoop. I'm guessing it can go anyway.
I presume so, but well, I just put the white side on the bit that was that said because that's, to me, it's this side that it was telling me to put it on.
Boom. And all is sorted. So yeah, that wasn't actually that difficult. It was, I'm not going to lie, it didn't taste very nice. It didn't smell very nice.
And it is uncomfortable up your nostril holes.
Yeah, Sophie and I were actually talking whilst we were just bagging it up. And we're hoping that they do a smaller size
For children and babies.
swab, yeah, because we're fully grown adults. I mean, I turn 30 tomorrow, and my nose is... It only just fit that swab up.
Yeah.
So, it wasn't really the best, but if it can be done this simple, then and we can find out if it is or isn't, then yeah, we'll be happy with that.
Yeah.
I mean, Sophie and I was talking last night, and we were thinking, well, if I had it, then surely it should come back on my sputum sample that I sent in last week. And I googled it, and actually sputum samples are more effective for picking it up than what the swabs are. So
yeah.
I already know that I clearly don't have it, but like I said, the doctor wants me to do it just to make sure. So now we have. So yeah, Sophie will go and run these to the post box. And yeah, it wasn't actually that bad. I'm quite surprised. So it's worth doing.
It's nothing to be scared of.
No.
Like we both felt anxious beforehand, and I think it's just because we both have the kinds of anxieties that
anything makes us anxious.
yeah, so like if there are things that you have to follow very strictly,
yeah,
it makes you feel anxious, but it was okay.
Yeah.
It's fine.
Yeah, not too bad at all. And the fact that it was all free, you don't have to pay for anything as well. It's just worth it. It's also worth it getting the vaccine. We will be getting ours soon. I've been given the okay to book mine now, but I'm not booking it at the moment because Soph has contacted our local MP to see if she can get hers done at the same time, because of her being my carer and obviously just twice leaving the house. It just isn't worth it, and obviously I'm severely vulnerable. So they have contacted the NHS to see if it can be done. So I'm waiting to see if I get another order number come through to then be able to book the two of ours together.
Yeah.
So yeah, ordinarily I think I would have had it done by the end of February, but this could mean it takes a bit longer, which I'm not bothered by.
I mean,
we're not going anywhere.
No, exactly. I mean, even once we've had all like completed our vaccines, we still probably aren't going to go anywhere.
No. But if you're wondering whether you should get a test or have the vaccine, please just think of people like us, and like particularly me. Like, I'm at home on oxygen, and if I get COVID, I will end up in intensive care, and there is an extremely high chance it will kill me. And obviously with Soph, there has been occasions where she's had to run out if I've needed emergency antibiotics and we haven't had anybody to help. So it puts her at risk, which then equally then puts me at risk.
Yeah.
The vaccine, it's not a live vaccine, so unlike with the flu jab, they put, like, that is a live vaccine that contains a strain of the flu that is going to be, well, that is seen to be rising of that year, and it's to try and help you build an immune system against it. This isn't one of those, so you will not be given COVID within that vaccine to try and get your system to work it up, like build a resistance. It's not that. So for just 2 little pricks from a small injection, you could be helping people like us and other people with severe illnesses, but not just that, but
everybody, like your own families and friends,
people who have a business. We've got a friend, her parents run a campsite. They're furloughed at the moment, and there are so many other people that are losing their job, losing their homes because they can't keep up the mortgage. And if people keep resisting not getting tested, not isolating, not being socially distanced, not having the vaccine because you're not pro-vaccine or whatever, then all these things that are happening to so many people, that's on your shoulders because you're not willing to help the people that's around you. And I know that sounds really harsh, but that is the truth. So yeah, it's that simple. We've just shown you how it's done. So if you need it, I will put the link for the website to get the home test if you do feel like you've got symptoms in the first comment of this video. It's not in the description. It will be in the comment section by us, so that it's easy to find and easy to follow. So yeah, just stay safe and just think of others and help others if you can. So thanks for coming on to save us, and we'll see you tomorrow.
Bye, everyone.
Good night.